Welcome to a very special edition of Managing Your Practice. It's a column that you'll usually read in one of Elsevier's global medical newspapers, but today we are bringing you the doctor who writes that column via video. Welcome, Dr. Eastern.
It's my pleasure.
So in your lecture, you talk a lot about overhead costs. I can imagine that this is a very common question that you get from your peers.
That's the number one question I'm getting now, just with the economy the way it is. The question that comes up the most often is, how do I cut back on my expenses? How do I decrease my overhead? And what I try to say in the talk, and I've said it over and over in the column, is that that might not be the right question, because most practices that I look at have already cut their expenses back to the bone. And if you start cutting even further, you're going to start having inefficiencies. You're going to start having less staff, not enough staff to do the job correctly. You're going to start crowding patients. You're going to start making the practice less efficient, and that's going to mean less revenue, and that's going to mean exactly the opposite of what you're trying to do. So I think a better question is, how can I increase revenue? Because as a famous retailer once told me, your ability to decrease costs is limited, but your ability to increase revenue is unlimited.
So I guess the $50 million question is, how can doctors increase their revenue in these tough economic times, not to mention the changing healthcare landscape that we're seeing all across the country?
Absolutely. Well, there's lots of ways. There's a lot of meat on the bone that most doctors are either unaware of or have just forgotten about. For example, we can learn to code better. Doctors tend not to code very well, unfortunately. In dermatology, dermatologists are very good at coding surgery. They do that very well because it's pretty cut and dried. The lesion is a certain size, you do all the measurements, and it falls, right? You plug it into the code and it falls in, and it's very matter of fact. With E&M codes, with the evaluation and management codes, it's a different story because they're more abstract and they're more open to interpretation, and a lot of people are afraid that they're going to overcode and they're going to get audited, and then they're going to owe the government a lot of money. And the fact is, what they usually do is err in the wrong direction and they end up undercoding. And so it's really important to look at your coding, to examine it regularly, to look at the CPT guidelines, and to get your coding right, because otherwise you're leaving a lot of money on the table.
But I think it's also important to note that in your lecture you say don't code for anything you don't do, but do code for every single service you perform.
Absolutely. This is sort of my mantra. Don't code for anything you don't do, but code for everything you do. I'm not for a minute suggesting that if you're doing a level 2 worth of service that you would code for level 3. That's fraud and abuse, and you get in a lot of trouble for that. What I'm saying is, if you're doing a level 3's worth of coding, you should code for it.
Okay, you gave some great information. Is there anything else you want to add to doctors out there that can better help them manage their practice?
The summary advice that I always give is you need to look at yourself, because your practice, like it or not, runs on your personality. And your staff copies your personality. So if you are compassionate and patient with patients, they will be compassionate and patient with patients. If you're rude and nasty to patients, they're going to be rude and nasty to patients because they think it's okay because the boss is doing it. So you need to look at yourself every once in a while and try and identify the personality traits that are not consistent with being a good physician, and work on getting rid of those personality traits. And as I always say, if you're unsure which traits I'm talking about, ask your spouse, because he or she will be happy. Absolutely. Your spouse will be happy to explain in great detail exactly what personality traits you need to work on.
Well, thank you so much for joining us, Dr. Eastern. This has been a video version of Managing Your Practice. For Elsevier Global Medical News Network, I'm Marquette Smith.